Stop taking these for herbal teas, hidden dangers for seniors. Herbal teas are often seen as harmless, even healing, and many seniors enjoy them daily for comfort and relaxation. Yet not every plant is safe to drink. Some teas contain compounds that quietly strain the body, especially after 50, when the heart, liver, and kidneys become more sensitive. Doctors warn that four popular herbal teas carry hidden dangers for seniors. They can interfere with medications, raise blood pressure, or damage vital organs when used regularly. Understanding which teas to avoid can make the difference between soothing your body and unknowingly harming it with every sip. If safe, healthy aging matters to you, subscribe now and join this community. Each week, you'll discover trusted guidance to protect your body after 50. Share your experiences in the comments so others can learn from them, and together we can spread awareness of safer choices for senior health. Licorice root tea is one of the most widely consumed herbal drinks, often used for sore throats, coughs, or digestive relief. It has a naturally sweet flavor that appeals to many seniors who wish to reduce sugar. Yet doctors caution that licorice root, when taken as a tea, can quietly become harmful, especially for people over 50. The danger lies in a natural compound inside licorice called glycyrrhizin. This chemical changes how the body handles sodium and potassium, two minerals essential for heart and blood pressure regulation. When glycyrrhizin enters the body, it causes the kidneys to retain sodium and water while flushing out potassium. This imbalance is similar to what happens when people take too much salt, but the effects are even more concentrated. The result is a rise in blood pressure and strain on the heart. For younger people with strong cardiovascular systems, this might go unnoticed for a while. For seniors, however, who often already battle high blood pressure or heart disease, the risk is serious. Doctors report that licorice tea can undo the benefits of blood pressure medications and worsen conditions like arrhythmia or heart failure. A clinical case published in the New England Journal of Medicine described a 70-year-old man who developed dangerously high blood pressure and irregular heart rhythms after drinking licorice root tea daily. His potassium levels had dropped so low that his muscles weakened and his heart rhythm became unstable. Once the licorice was stopped, his condition improved, but the case highlighted how even herbal teas can cause medical emergencies in older adults. The heart is not the only organ affected. Low potassium, caused by excess licorice, can also lead to muscle cramps, fatigue, and confusion. Seniors may notice swollen ankles or sudden dizziness, not realizing that a daily cup of licorice tea is contributing to the problem. Doctors warn that these symptoms should never be dismissed as normal aging when hidden causes may be at work. Another issue is the interaction between licorice root and common medications. Seniors often take diuretics, heart medications, or drugs for high blood pressure. Licorice tea can counteract their effects, making the medication less effective or even dangerous. In some cases, the combination worsens potassium loss, leading to complications that require hospitalization. Pharmacists frequently caution older adults to avoid licorice tea if they are on prescriptions that affect the heart, blood pressure, or kidneys. Even those without a formal diagnosis of hypertension are not immune. Blood pressure naturally increases with age, and the stiffening of arteries makes the heart more vulnerable. Adding licorice tea into this environment introduces a silent risk that may tip the balance toward stroke or heart attack. Studies show that long-term licorice consumption, even at moderate levels, raises systolic blood pressure by an average of 7 to 10 points. For seniors already close to the threshold of hypertension, this increase is enough to move them into dangerous territory. The problem is that many people assumed herbals means safe. Licorice root has been used in traditional medicine for centuries, but traditional use was usually short-term and carefully measured, not daily sipping as a sweet beverage. Modern teas often contain higher concentrations, and some blends even combine licorice with other herbs, multiplying its effects. The cumulative impact on seniors who drink it every day can be far greater than expected. Doctors also highlight that licorice's effect is not immediate but builds up with regular use. A single cup may not cause noticeable harm, but weeks of daily consumption can gradually elevate blood pressure and lower potassium. This makes the risk more deceptive. Seniors may feel fine at first but then slowly develop fatigue, headaches, swelling, or chest discomfort without realizing the connection. By the time the symptoms are linked to licorice, the damage may already be advanced. There are safer alternatives for those who enjoy sweet herbal teas. Cinnamon, rooibos, or chamomile offer pleasant flavors without disturbing blood pressure. If a sore throat or cough is the reason for drinking licorice tea, honey with warm water or ginger tea can provide relief without the cardiovascular risks. Doctors encourage seniors to ask their healthcare provider before trying any new herbal tea, especially if they have a history of hypertension, heart disease, or kidney problems. Awareness is essential. Many seniors reach for licorice tea believing it is a gentle, healing choice. In reality, it is one of the most dangerous herbal teas for people over 50. The heart, blood vessels, and kidneys are already under strain with age. Adding glycyrrhizin into the mix only intensifies that strain. Seniors should avoid licorice root tea entirely if they are on heart medications, have high blood pressure, or are at risk of potassium imbalance. Protecting the heart after 50 requires vigilance. Herbal teas can be supportive, but they must be chosen wisely. Licorice root, despite its popularity, is a silent threat that can undo years of careful management of blood pressure and heart health. By avoiding it and choosing safer alternatives, seniors can continue to enjoy the comfort of herbal teas without exposing themselves to unnecessary harm. Comfrey tea has long been used in traditional herbal medicine for digestion, inflammation, and even bone healing, but modern research has revealed serious risks that make it unsafe, especially for seniors. The concern comes from compounds called pyrrolizidine alkaloids, naturally found in comfrey leaves and roots. These substances are toxic to the liver. Even small amounts taken regularly can slowly damage liver cells, leading to scarring, reduced function, or in extreme cases, liver failure. The liver plays a vital role in detoxifying the body and processing medications. As people age, the liver becomes more vulnerable, and its ability to handle toxins decreases. Doctors caution that when seniors drink comfrey tea, the toxic compounds add an extra burden to an already sensitive organ. Unlike many other risks, this damage is often silent at first. The liver has no pain receptors, so injury may not be noticed until serious symptoms such as fatigue, yellowing of the skin, swelling in the abdomen, or confusion appear. By that stage, the condition may already be advanced. Several countries, including the United States, Canada, and parts of Europe, have restricted or banned comfrey products for internal use. Health authorities concluded that the risks far outweigh any benefits. Despite this, comfrey tea is still available in some markets or online, where it may be marketed as natural and safe. Seniors who are unaware of these bans may continue to drink it, not realizing that experts around the world have agreed it is too dangerous to consume. Research published in the Journal of Toxicology showed that pyrrolizidine alkaloids in comfrey are metabolized into substances that directly damage liver blood vessels. This condition, known as hepatic veno-occlusive disease, restricts blood flow through the liver and can lead to swelling, pain, and eventual liver failure. The study concluded that even moderate intake over time could cause irreversible injury. Seniors, who are often already taking medications metabolized by the liver, face a significantly higher risk of complications. Another danger is that comfrey tea can interact with prescription medications. Because it damages liver cells, it can alter how drugs are broken down, increasing the risk of side effects or reducing the effectiveness of treatment. Seniors taking medications for cholesterol, blood pressure, arthritis, or diabetes may be especially vulnerable. Doctors emphasize that comfrey tea is not safe in any amount for people with existing liver disease or those on long-term medication. One clinical case described a woman in her 60s who developed severe liver failure after drinking comfrey tea daily for several months to relieve arthritis pain. Her doctors determined that pyrrolizidine alkaloid toxicity was the cause. This case and others like it underline how seemingly harmless herbal teas can create life-threatening outcomes in older adults. The problem with comfrey is not limited to strong brews. Even weak teas contain enough of the toxic compounds to be harmful when consumed repeatedly. Unlike nutrients, which the body uses and regulates, toxins from comfrey accumulate in the liver. With each cup, the damage quietly increases. Seniors who believe they are supporting bone health or soothing digestion with comfrey are instead putting their liver at risk. Safer alternatives exist for the same purposes. For bone health and joint comfort, teas like ginger or turmeric provide natural anti-inflammatory benefits without harming the liver. For digestion, peppermint or chamomile are widely recommended and considered safe when used in moderation. These alternatives provide gentle relief without exposing the liver to toxic compounds. Doctors and herbal safety boards now consistently advise against any internal use of comfrey. Topical creams or ointments made from comfrey may sometimes be used under supervision, but teas, capsules, or extracts taken by mouth are strongly discouraged. For seniors, the margin of safety is even smaller, since the liver is less resilient with age and often already burdened by prescription drugs. Comfrey tea represents one of the clearest examples of why a natural does not always mean safe. Its risks are documented, predictable, and preventable. By avoiding it, seniors can eliminate one major source of hidden liver damage. Protecting the liver after 50 is essential not only for digestion but for overall vitality, as the liver regulates blood sugar, cholesterol, and hormone balance. In conclusion, comfrey tea should not be consumed by seniors or by anyone because of its potential to cause irreversible liver damage. The dangers outweigh the supposed benefits, and safer options are available for every purpose comfrey was once used for. Staying away from comfrey tea is a simple, powerful choice that helps preserve liver function and supports healthier aging. St. John's wort is an herb often used as tea to improve mood, relieve anxiety, or support sleep. It has been part of traditional medicine for centuries, but in modern times, doctors have raised strong warnings about its safety, especially for seniors. The main concern is not toxicity to organs like the liver or kidneys but its powerful effect on how the body processes medications. Seniors, who often take several prescriptions daily, face unique risks because St. John's wort tea can interfere with those medications in dangerous ways. The herb contains active compounds called hypericin and hyperforin. These chemicals stimulate enzymes in the liver and intestines that control how drugs are absorbed and broken down. When these enzymes are overactivated, many medications pass through the system too quickly and lose their effectiveness. For seniors depending on drugs for blood pressure, cholesterol, mood, or heart rhythm, this loss of effectiveness can have life-threatening consequences. Doctors frequently point out that St. John's wort interacts with more than 60 known medications. For example, it reduces the effectiveness of blood thinners like warfarin, raising the risk of stroke or clot formation. It also interferes with cholesterol-lowering drugs, blood pressure medications, and antidepressants. Seniors who take heart medications such as digoxin or anticoagulants are particularly vulnerable. In these cases, St. John's wort tea can quietly undo the very treatments designed to keep them safe. Antidepressant use is another area of concern. Some seniors take selective serotonin reuptake inhibitors, SSRIs, for depression or anxiety. When combined with St. John's wort tea, serotonin levels can rise too high, leading to a dangerous condition known as serotonin syndrome. Symptoms include agitation, rapid heartbeat, sweating, and in severe cases, seizures. Doctors emphasize that this combination should be strictly avoided. A case study published in the British Medical Journal described a 62-year-old woman who experienced transplant rejection after drinking St. John's wort tea while on immunosuppressant drugs. The herb accelerated the breakdown of her medication, leaving her body unprotected. While this may seem like an extreme case, it highlights how deeply St. John's wort alters drug metabolism and why even occasional use is risky. Unlike some herbs that cause immediate side effects, St. John's wort creates problems silently over time. A senior might drink the tea regularly, feel no discomfort, yet find that their blood pressure medication no longer works, or their mood stabilizer seems weaker. Because the effects are indirect, the link to the tea is often missed. Doctors may increase medication doses without realizing the real issue lies in the herbal tea. This cycle can lead to worsening conditions or new complications. St. John's wort also increases sensitivity to sunlight. Seniors who drink the tea regularly may notice easier sunburns or rashes after being outside. While this may seem minor compared to drug interactions, it adds another layer of risk, especially for older adults with thinner skin that already burns more easily. Pharmacists and doctors consistently advise seniors to avoid St. John's wort tea if they are taking prescription medications of any kind. The list of possible interactions is too long, and the risks too high. Even supplements or teas marketed as mild still contain enough active compounds to trigger enzyme changes in the liver. Some experts go so far as to recommend avoiding St. John's wort entirely, since its risks outweigh its uncertain benefits in older populations. For seniors looking for safe teas to support mood and relaxation, alternatives like chamomile, lemon balm, or lavender can be used in moderation without the same drug interaction risks. These herbs provide calming effects without interfering with prescription medications. Doctors recommend discussing any new herbal tea with a healthcare provider before making it a daily habit, especially when multiple medications are already part of the routine. The key lesson from St. John's wort tea is that natural does not mean harmless. It acts on the body with a strength that rivals prescription drugs, and because it is unregulated in many markets, doses can vary widely between products. For seniors, whose health often depends on carefully balanced medications, this unpredictability is especially dangerous. In summary, St. John's wort tea is not safe for seniors who take prescription drugs. Its powerful interactions can weaken life-saving treatments, increase risks of stroke, heart problems, or serotonin syndrome, and cause complications that may go unnoticed until they are severe. By avoiding this tea, seniors protect the stability of their medical care and reduce the chance of dangerous surprises. Safer herbal teas exist, but St. John's wort is one that should be left off the list. Pennyroyal tea is sometimes promoted as a natural remedy for digestion, colds, or menstrual discomfort. It has a mint-like flavor that makes it appealing, but doctors and toxicologists agree that pennyroyal is one of the most dangerous herbs to consume, especially for seniors. The plant contains a chemical compound called pulegon, which has been shown to damage the liver, kidneys, and nervous system. In high doses, pulegon can cause seizures, organ failure, and even death. Because of these risks, pennyroyal tea is strongly discouraged by health authorities, and seniors are advised to avoid it entirely. The liver is the primary organ affected. Pulegon is metabolized into toxic byproducts that overwhelm liver cells, leading to inflammation and cell death. Seniors are already more vulnerable because their liver function naturally declines with age and is often burdened by prescription medications. Drinking pennyroyal tea in this context adds an unnecessary and dangerous strain. Cases of acute liver failure linked to pennyroyal have been documented, with some requiring hospitalization and intensive treatment. The kidneys also suffer under the toxic load. Studies in animals and reports in humans show that pennyroyal compounds can damage kidney tissue, reducing the organ's ability to filter waste. Seniors with high blood pressure, diabetes, or pre-existing kidney problems are particularly at risk, since their kidney function is already fragile. Even small exposures can accelerate decline. This makes pennyroyal especially hazardous in older adults, where maintaining kidney health is critical for overall well-being. The nervous system is another target of pennyroyal toxicity. Pulegon and its metabolites act directly on the brain and nerves, causing tremors, confusion, or seizures. Seniors may experience sudden dizziness, disorientation, or headaches after drinking pennyroyal tea. These symptoms can be mistaken for age-related memory decline or balance problems, but they are actually signs of toxic stress on the nervous system. In severe cases, seizures and coma have been reported after pennyroyal ingestion. The dangers of pennyroyal tea are well documented. The U.S. Food and Drug Administration has listed pennyroyal oil and tea as unsafe for human consumption, and several countries have banned its sale for internal use. Despite this, pennyroyal products are still sometimes marketed online or through herbal shops as natural remedies. Seniors who see the word herbal may believe the tea is safe, when in reality it is one of the most toxic herbal drinks available. doctors emphasize that pennyroyal has no safe dose for seniors. Unlike some herbs, where moderation may reduce risk, pennyroyal is unsafe at any level. Its toxic compounds accumulate, and even small amounts can cause harm if consumed repeatedly. Seniors who wish to enjoy herbal teas for relaxation or digestion should choose safer alternatives such as peppermint, chamomile, or ginger. These provide soothing effects without exposing the liver, kidneys, or nervous system to dangerous toxins. A clinical report published in the Annals of Internal Medicine described a case where a woman developed severe liver failure after using pennyroyal tea as a home remedy. Her condition deteriorated quickly, and despite intensive medical care, the toxicity was life-threatening. This case highlights why doctors strongly advise against pennyroyal use and why seniors, in particular, should avoid it completely. Beyond organ toxicity, pennyroyal also interacts negatively with medications. Because it damages the liver, it interferes with how drugs are processed, potentially leading to dangerous side effects or reduced effectiveness. Seniors who already take medications for blood pressure, cholesterol, or arthritis could experience unpredictable interactions. This hidden risk makes pennyroyal even more unsafe in the context of senior health. Herbalists and modern health experts agree, pennyroyal should not be consumed as tea. While it was once used in folk medicine, knowledge has grown about its toxicity, and safer options are available today. Seniors benefit most from herbal teas that calm, hydrate, and gently support digestion without placing stress on vital organs. Pennyroyal does the opposite, undermining the very systems seniors most need to protect. Not all herbal teas are safe, and pennyroyal is one of the clearest examples of hidden danger. Its compound pulegon harms the liver, kidneys, and nervous system, creating risks that are magnified in seniors. Unlike herbs with mild effects, pennyroyal is toxic enough that experts recommend avoiding it entirely. The lessons from pennyroyal apply more broadly. Seniors should always approach herbal teas with caution, especially those less familiar or not widely studied. Licorice root can raise blood pressure, comfrey damages the liver, St. John's wort interferes with medications, and pennyroyal is outright toxic. By steering clear of these for teas, seniors protect their heart, liver, kidneys, and overall safety. Safer choices exist. Teas like chamomile, peppermint, rooibos, or ginger can provide comfort without hidden risks. Protecting health after 50 is not just about adding good habits but also about avoiding silent dangers. Choosing the right herbal teas is one small but powerful way to safeguard independence, vitality, and peace of mind.